specialize as a trauma surgeon and emergency medicine doctor.
Syria. We have met before, of course. I interviewed you then, didn't hire you. I think we need to do it again.
I know I screwed up. Taking that job without telling you was...
You're almost in your 4th year, June. You should consider applying for the chief resident position.
All I could hear was your voice in my head.
Telling you what?
That I'm focusing on all the wrong things.
Sir, a collapse in the nostrils pulse. Ischemic stroke?
Or hemorrhagic. Charging!
I knew he still had symptoms. Rania.
Bashir.
Rania, you were dead. Everyone thought so. Mom said it in the call.
ما معقول شكلك كبران.
Rania was always brutally honest with me.
لأنه أخوكي كان يخبي كل شيء بقلبه.
كيف صارك؟ ايمت شلون؟
وصلت من كم يوم. لسه فيكم تتجوزوا؟
أميرة.
على سيرة الصراحة.
How long have you known we were here?
Since you came.
وخليتيني أفكر إنك ميتة؟ ل5 سنين.
كتير حكي بدي أقلك.
Bash. I know you're already clocked out, but we need hands. Multicar NBC, they're about to call it.
They call you Bash. Did you let them?
It's growing on me.
Go be a doctor. طلع حالك شلون صرت يا باشي. You said this place would swallow me whole if I let it. And then you went and had a stroke, which, let's face it, is a pretty extreme way to make your point. The past is the past, Dr. LeBlanc. What matters now is how you respond.
Mags, Code Orange, all available personnel.
Thanks.
Hey, do you know what's going on?
Just that they're calling everyone. Has he said anything yet?
No, and the first few hours are critical. Hopefully he works again soon.
It's Bishop, he will. So haven't you been working 2 days straight?
Says the girl who's about to double her workload by throwing in for chief surgical resident.
Okay, look, I became a surgeon because I prefer my patients unconscious. I'm not sure I should be managing other people.
Wait, so you're not gonna try because you're afraid to fail?
I'm not afraid, Mags, okay? I just know what my skills are and what they aren't.
Notify the blood bank, prepare for MTP.
Where do you want, Mr. Klein?
Hallway for now. We need to make sure all lower acuity beds are cleared.
Copy that.
See if you can put them on 3. Rhoda, who's in 2? Migraine, DHE, resolving. Okay, put him somewhere else. Same with the ankle sprain.
Any idea what we're dealing with? I can call ahead to OR.
All I know is a bus went through a guardrail on the Bayview extension.
That's not far from here. I can go to the site for triage.
Good, good. There's a trauma team en route from St. Jacobs. Mags,
I'm in.
update us when you get there. We run this like he taught us.
Sorry.
So what's going to happen now? With Dr. Bishop out?
Well, the board appoints an acting chief until they know his status. If they're smart, it's Atwater. If they're stupid...
Everything changes.
Oh, my God.
Let's assess who's injured and make a plan. Triage everyone coming out of the bus. Priority on the quiet ones. If they're crying, they're breathing.
Help's here, guys. Help's here.
start moving.
Emily and other kids in there who can't get out.
Well, are you the bus driver?
I don't know what happened. I think I hit black guys or...
Joni, she's got a head wound.
Got it. Here, come with me.
If you can crawl to the windows, the firefighters will help you. Are you okay?
Yeah, I'm okay.
Emily! What's your name? Lucas. It's going to be okay. Lucas, where does it hurt most?
My neck. Real bad.
Where are you coming back from, Lucas?
Millwood Arts Camp. It was winter overnight this weekend for the counselors in training.
Any pain besides your neck?
My hand's kind of tingle.
Squeeze my fingers. Good job. Try to stay very still, okay?
What is that?
Possible fractured vertebrae. We won't know how bad until we image. Get him on a spinal board. Try to keep him still. If he decompensates, come and find me.
Okay.
Everything's gonna be okay. Who needs help? If you can't speak, raise your hand. Is your name Emily?
Are you okay? Can you get out? Can you get out?
Max, she's got a projectile in her neck right next to her jugular. We can't move her and we can't intubate around it. It has to come out.
It's too risky. We need to protect her airway.
There's no point if she bleeds out.
Hang in there, kiddo. Even if you remove it cleanly, she's hemorrhaging. How can you suture a wound that big here?
I don't. Get me the Foley cath. I'll remove the projectile, and you stem the bleeding with that.
How?
I'll talk you through it, but it has to be now. There's no way I'm leaving her like this.
Morphine, forceps, scalpel.
Okay, Emily. I'm going to remove the obstruction from your neck to stop the bleeding. You can feel a sharp pinch and some warm liquid, okay? When the debris comes out, the cath goes in and then inflate with saline.
How much?
Until you feel resistant. Trust your instinct, okay? You ready?
Yeah.
Okay. Okay, go.
There.
Okay, good, good. Emily, can you hear me? Emily, Emily, open your eyes if you can hear me. Emily. Stay with me, Emily.
Wow. Out like a light.
Should we move them?
No, just leave him a bit longer.
Do you have to go?
I'm sorry.
Max! Lizzie can't move her leg. Hey, Lizzie. I'm Dr. LeBlanc. How about your toes? Can you wiggle them? LOC's low, knees dislocated. Leg has no pulse. We're gonna have to reduce her. She could lose it. Bracelet. We need to find it. How about we add this one to your collection for now, okay? Lizzie, we're gonna have to put your knee back into place. It's gonna hurt, but the worst part's over fast, okay? You ready? 3, 2, 1.
You're doing great, Emily. I'm not going to leave your side.
Emily, please. Let me ride with her.
It's fine, officer. She needs medical attention anyway.
some time, but she lost a lot of blood.
It's okay, Brennan. I got you. I got you. I got you.
I feel like you do more than drive the bus.
I judge talent shows and paint theater backdrops. So the kids are also creative, you know. Her mom owns the camps. I've watched them grow up, all of them, really.
How long have you worked there?
7 years. It's near Midland, where I'm from, so not much to see.
I haven't seen anything in Canada outside of Toronto, so...
It's okay. I got one for you. Why should you never trust Adams? No, don't tell me now. Tell me later when you're better, okay?
Are you okay?
Yeah, I'm okay. I'm dizzy.
You might have a concussion. We'll check you out too once we get there.
What's wrong? What's happening? What is it? It's okay. I'm right here. Lucas, oh my God.
Lucas West, impact trauma with potential spinal complications.
Right, I'm getting into CT. Emily Parker, projectile removed from her neck to address massive blood loss. BP's 90/60, rates 90, O2's 80 and dropping.
Trauma 1. Dr. Ahmed, what's happening?
Arnold, she might have a concussion. Up, ma'am. What do you think?
Female impact trauma dislocating and reduced on site. Rate stable. BP's 110/80.
Come on. It's gonna be fine, okay? I need one more large bore IV. Activate MTP, 1 gram TXA.
Blood sats are falling fast.
1 unit. ONEG, level
I
1.
need to maintain her airway, but I'll tell you right now, it will be difficult to visualize her cords.
Get RT on standby. I will intubate.
I can do that, Wendy.
Hello, Mark.
Rough night here, huh?
Slow up in the ICU?
Not really. Good. And connecting the vent. Blood's helping. MEP's at 65. She's stabilizing.
O2's coming up.
I'll call vascular. She'll need the OR.
Gonna need a lot more than that. Who rigged up the tamponade balloon?
I did.
Protocol would be to leave the shrapnel in place until she got into surgery.
Protocol would have killed her.
Well, I just agree that it was a ballsy move that may have saved her life, but you still damaged her airway when you blew up the balloon, and that's not gonna be good. What is your name, doctor?
Bashir Ahmed.
Why don't you get her cleaned up, Dr. Bashir Ahmed, and we'll let the surgeons tell us what the damage is.
I'm sorry, but who are you?
Mark Novak. I'm the acting chief of this emergency department.
Lucas started gasping for air on the way back from CT.
You're gonna get the ultrasound?
Yeah.
I can't breathe. I can't breathe.
We're gonna find out what's going on, okay? Okay, there's no lung sliding on the right side. Traumatic pneumothorax. Could I get a 24 French and a chest tube tray? We're gonna keep you really still. Just gonna get your arm out of the way. It's gonna help you breathe better. All right, there we go. Get that tube.
Okay. What's happening?
You have a collapsed lung, but Dr. Curtis is going to fix that.
Inserting chest tube now.
So what are we looking at here?
And we're in. Hemo. How's that feel, Luke? Is that better?
My neck really hurts, and my feet are tingling.
Positive Babinski sign.
What do you think, neural dysfunction?
His CT should be up by now.
Hey, Lucas, that pain you're talking about, is it sharp or dull?
Sharp. It's sharp.
Okay.
I'm scared.
Hey, Lucas. What's your favorite thing to do at camp?
I'm learning drums.
Drums? Okay. What kind of music do you like?
Loud.
I'll be right back.
What do you got?
Look at this.
So that lateral-occipital dislocation, it happens during impact trauma. His head is only holding on by muscle and skin.
Yeah. Internal decapitation. He's lucky we didn't intubate. It's gonna be okay. We're gonna fix it. You'll see.
Bash.
Didn't you fly home a few hours ago?
Long enough to put the kids to bed. Just right back on a patient transport chopper.
Perks of being an attending now. How'd Mel take you leaving?
Our darn when a bus full of kids crashes. Yeah, it's brutal. Peach from all 3 shifts were called in. Yeah, I heard what you did for Emily Parker. She's lucky you were there.
Let me know if you need anything.
Sorry, you, Dr. Hunter.
Hey, so 3's waiting on casting for her ankle. She's allergic to morphine, so acetaminophen only. Make sure whoever does Maya sutures knows to use a 5-0, nothing larger. And the boy in 4 keeps taking his dressings off to post videos, so just keep an eye on that.
Okay. Oh, hey, what do you know about the new acting chief?
He did his residency at Memorial back in 05 under Bishop. Joined specialty in ED ICU, I believe. Then went overseas, got back, and he's been attending in our ICU for about a month. Works mostly nights. That's Janie, 3 broken ribs, but she's asthmatic, so keep her on albuterol and check her breathing every 10.
Every 10. Oh, Bash. Radiologist had to tell you that CT on Allie Watson is normal. No sign of fracture or bleeding, but she did vomit.
Could still have a concussion. Thanks. Arnold.
Tech wasn't positive, but he said he might have smelled alcohol.
You think she was drinking?
I'm just passing along the info.
How's
They're prepping her for surgery. How's your head feeling?
I'm okay. What about the others? I gave the social worker my phone so she could call the parents.
We're on it.
Okay.
So, what about you, Ali? Is there anyone we can call for you, family you want down here?
No, it's just my mom and her boyfriend, but we don't talk anymore. I never really fit in with anyone from home, but Sandra built this world for kids like I was and made me a part of it. So she's the one I'd call.
Ali, did you have anything to drink tonight?
Coffee before we left and some water.
No alcohol? A beer with
No. You think I was drunk? Because I threw up?
Vomiting can happen as a result of a head injury, but our tech said he smelled alcohol.
I'm allergic to alcohol. I never touch it.
Maybe he mistook a disinfectant or hand sanitizer.
Yeah. The police said they have to do a blood test, so check it if you don't believe me.
It's not that. It's the tech smelled it, so I had to ask. Okay.
So, how angry are you?
Oh, maybe he's different now.
You found Lizzie still on the field?
Yeah, her knee was dislocated.
Do we need to page vascular?
She stabilized after I reduced, and we gave her morphine, which really knocked her out.
Her BP's ticked down since she got in. Was there a lot of blood?
External injuries were scrapes and bruises, but could be the knee, hematoma from reduction.
That is a lot of bruising for a dislocation.
Yeah.
Is she on blood thinners or anemic?
But she was worried about a bracelet. I thought she meant a friendship bracelet, but... Lizzie? Lizzie, can you look at me? Lizzie, can you hear me? Hi, Lizzie. Was your bracelet the medic alert kind? Am I bleeding? Are you hemophiliac?
I took it off. I know it was wrong, but...
I'm Dr. Hunter. Lizzie, don't worry. We're gonna get your bleeding under control.
I'm supposed to tell you I'm type B, which means...
You need clotting factor 9.
Are you the plug?
Yes?
We need you back out here.
Right, copy that. It's just that we just confirmed that this patient's a hemophiliac, so I'm gonna track down her team.
Short of cloning yourself, I don't see how you're going to do that and clear the orange and green tags. Also, your schedule says that you've been on for 2 days straight.
Right, but Dr. Hunter...
We'll be fine. Unless he thinks he can't hack it on his own.
He does not.
Yeah. Hey, that tamponade balloon. Where did you learn that trick?
We used that when we couldn't get hospital transport. I was a trauma surgeon back in Syria.
I know you're a first-year resident here. I ran field hospitals in Gaza, Libya, and Yemen for Doctors Without Borders, but I never made it to Syria. I know what you're thinking. Privileged Westerner gets to indulge his adrenaline addiction, and yeah, you wouldn't be wrong, but...
They do important work.
Yeah, the men's bathroom.
Sir, back in trauma, if I was short with you, it's only because
You took a risk. Save a kid's life. And you didn't realize you were talking to your new boss. And now, you don't know where you stand after breaking protocol. Well, I would say somewhere between the choice you made and the outcome. So, let's see how the kid does.
Oh, let me guess. You want me to rush labs for Lizzie Stahl?
Nope, she is not my patient anymore. How's the new guy already telling me I got too much on the plate? And you know nothing against Theo, but I'm just saying, he flew back on a helicopter after being home for like 3 hours. And have you ever heard anyone ask him how much sleep he got?
I never have.
No, exactly. Jeez. What is it about me that makes people so concerned with how much I take on, you know? It's infantilizing.
What? You need their approval.
I don't.
I saw you in Bishop's room. You're wanting him to tell you what to do even when he can't talk. You look up to him, Mags. But I know him. He's not God. He's just another messy human being who is wrong as much as he is right.
Well, that's some light reading.
Studied to be a nurse practitioner. Master's at night school, and then a year of clinical.
That's amazing. You'll be able to order prescriptions and make diagnoses.
Without needing sign-off on what I already know.
That's nice. Maybe I should go look in there.
Lucas, I'm Dr. Singh. When you were thrown from your seat, you injured your spinal cord.
Can you undo these?
You need to keep perfectly still.
No, I can't. I need to move.
Okay, look, this is really important, okay? 2 of the vertebrae in your neck are broken, so if you move, the part of your spinal cord that's still attached will sever.
Does that mean that if I can't stay still, it could kill me?
What we're saying, son, is we're going to take you to surgery to fix this. But until we get there,
I can't.
prepare 2 milligrams of Ativan.
Okay, I understand. Lucas, okay, I get it. Trust me, I hate staying still also, and it makes my skin crawl when someone tells me that I have to.
My mother says I never stop moving.
My mom says the same thing. And then I became a surgeon, and other people's lives in my hands, just no room for wrong moves. So I had to learn how to control that panicky feeling. I'm pretty sure that if I can do it, you can do it too.
How?
How? Well, we start by setting the mood.
Hit the lights, Dr. Singh.
Please. So, no talking. Focus on what you can hear. Can you hear your heart beating? It sounds like drums, right? Focus on that rhythm. It's a little fast right now. And you need to bring that down. So see if you can use your breathing to slow down the rhythm of that beat. Focus on that rhythm. Slow down that beat. You're nailing it.
How is she? You're hurt. You didn't tell me. I'm okay. Maybe a small concussion. So glad you're all right. Allie, what happened? I don't know. It was all so fast. Everything was fine, and then it wasn't. We must have hit ice or... Sandra, I'm so sorry. I'll talk to the parents, okay?
Ali, you should be off your feet.
This is the doctor who saved them. This is Sandra, Emily's mom. She owns the camp.
They said that you had to take drastic measures to save her life.
Emily was extremely brave. Ali, can I speak with you for a moment?
I know you said to rest, but I had to see her.
Ali?
Are you okay? It's weird.
Come on,
What's happening? Is she okay? My throat feels full. It's hard to swallow.
Arnold, 0.3 mg epi right now. Breathe calmly, okay? I'm giving you an injection of epinephrine. You're having an allergic reaction. This will help with the symptoms.
An allergic reaction to what? Is she okay?
She will be. She'll be fine.
She's only allergic to alcohol and she doesn't drink. She was drinking?
Why don't we just let Annie get better?
What happened, Dr. Ahmed?
Allie, you were drinking when you knew you were driving our kids?
No, I would never. You did a blood test. Tell her what it said.
He came looking for you because of what it said. Allie, how could you?
There has to be another explanation.
I'm sorry.
No, Emily, the kids, they're everything to me. You know me.
No, not anymore. Not the way I thought.
Sandra.
I can't even look at you.
Please, please.
Okay, we're almost there.
Curtis is scrubbing in.
Well, there's 3 T's, AJ. It's already pretty crowded.
June made the diagnosis, and the patient's asking for her personally.
Fine. Observation only.
I'm gonna be with you the whole time. You're doing great.
Sutton gets a vote on chief resident. Don't keep him waiting.
Admitting needs a detailed projection of who you're keeping.
I know. Just after I get to the 4 sets of parents waiting for me.
I'll find out what Novak wants for paperwork. Dr. Bishop likes every intake, every discharge on his desk an hour after your shift.
How's he doing, Bishop?
Well, too early to say.
Long night?
Emily Parker's in surgery?
I'll keep you in the loop.
Thanks.
You like it? Just like Mama's.
Amira, it's so late. You have school tomorrow.
الحق علي. عملنا شغلات غناتية وانتبهنا على الوقت. نسيت حد بالبقولة كتاب المستشفى.
I have to stay here a little while longer. You can bring her to the hospital if...
We're fine. I promise she'll get some sleep.
Okay, I'll come get you soon as I'm done. Go to sleep.
أنا حدا حقيقي.
بشيرة.
Surgeons were able to repair the wound to Emily's artery, but her trachea was damaged when our doctor stopped her bleeding.
Why would he do that? There wasn't any other way?
If he'd waited any longer, she would have bled to death. We've done everything possible to repair the damage. Now it's up to her to see how she recovers. I'm sorry I have to say this, but if her airway doesn't heal, there's a chance that Emily won't be able to breathe on her own again. The next few hours are critical. I know it's a lot to take in.
I don't accept any of it.
Hey, Lizzie. Firemen found this. Are your parents around?
Probably with my hemophilia team somewhere deciding all the things I won't be allowed to do anymore.
They only want you to be safe.
The Cabin 5 girls were doing a play. They always say mine are too weird, but this year they chose it. They all wore 5 bracelets, and
you had 6.
I just like to feel normal for once.
Let me tell you something, Lizzie. Normal is boring. I know it's hard to see this now or ever, really, but you know the things that set you apart, even the hard ones, they're the ones that make you strong. You okay?
I think something's wrong.
Our
chest hurts.
Okay. Claire? Okay. We need to look at the site of your bleeding. Okay, I need a large dose of RTPA, 0.5 milligram per kilo per hour, then page CO and heme.
What's happening?
So a large blood clot formed after your injury, and it's now traveled to your lungs, so I'm gonna need to use something called a thrombolytic agent to dissolve it.
A clot buster? But if we do that, my blood thins. Won't that make me bleed more?
A clot's a bigger risk. You can handle this, Lizzie, okay? You need to. Theo?
Nothing yet.
It's okay. It's just blood. We need to do this now. We can't wait. Okay, give me your arm. Lie back. Keep going. Like this. Okay? Good.
What now?
We wait. Together.
New lapse on Allie Watson, but it's weird.
What? Her blood alcohol level went up?
Like I said, weird. No way she's had a drink while she's been here.
She may not have had to. There's a rare bacterial reaction where your GI system creates its own alcohol. It's called autobrewery syndrome. Did you have any bread tonight, pasta?
Pizza.
Well, the right carbs at the wrong time and you basically become your own distillery.
But why now? I've always eaten those things.
Well, there are emergent digestive conditions that can trigger it, even being on antibiotics for a really long time.
Yeah, I've been on and off them for sinus infections.
Well, your stomach continued to produce its own alcohol, which is why your reaction was delayed in the first place. Thanks, Arnold. You're on an epi-drip now, and we're going to give you some activated charcoal to drink, so that should stop the reaction completely. Doesn't look very appetizing, but I promise it will help.
Then I was drunk. Maybe I didn't realize. How could I have known?
This isn't your fault, Ellie, okay? And I'm going to make sure Sandra knows that.
You must be exhausted.
Were the girls upset I wasn't there when they woke up?
A little, but... You know, a bus full of kids, that has to be more important.
No, that's not what I meant. The good news is I already bought my flight pass, so I'll be able to go back and forth 4, even 5 times a week.
Theo.
No, I got it all planned out, okay? I'm gonna do my scheduling and my charts. I'm gonna do them all on the plane, so when I get home, there's no work. I mean, half the doctors here, they commute from the suburbs. It's like a 2-hour drive with traffic, so I mean, it's no different.
I'm just not sure that's realistic.
No, what?
I gotta go. We'll talk about it later. Okay? Okay?
Yeah, okay.
Bye.
You heard about Ali?
Maybe she didn't drink, but she must have felt something. She should have pulled over, stopped driving.
I only found Emily in time to save her because of Ali. She loves her, and she's terrified of losing the life that she's built with you.
I care about her too, but she'll have to find a new job. This is my daughter, who may never breathe on her own again because of what both of you did.
We need to talk about you giving Lizzie Stoll a thrombolytic agent.
Well, we paged you. And we both know that if I'd waited...
There were 2 hematologists here from her team, plus 2 very worried parents, and a new acting chief. And I had to explain to all of them why this happened without their input.
Theo, I went in to return her backpack and she crashed.
If I wanted your help and I wanted you to check on my patients, I will ask you.
Was Dr. Bishop here during your residency?
Has he ever not been here?
Dr. Novak, Emily Parker, she's
She'll touch and go, yeah, I heard. Also heard what you did for him. How you saved his life. You made some hard choices. Friends I've had, doctors from overseas, tried to make it over here. Those skills, they didn't always translate. You're one of the lucky ones, Mr. Ahmed.
I heard Lucas is going to recover completely.
Yeah, it's just this kid is like a millimeter from death, and somehow he still manages to hold it all together.
He had some help.
I've been thinking about all the reasons I've been afraid to throw in for chief resident, and I don't know, I guess tonight I realized that none of that really matters. I want it, you know, so I don't know, whatever. I guess I just have to learn as I go.
If you get it.
Come in, LeBlanc.
You changed the lamp? Moved it.
Is there something you needed?
I wanted to tell you that I made the call to give Lizzie Stahl thrombolytics without consulting Dr. Hunter first because...
Yeah, that was a right call.
I know.
Okay. Did you come in here to apologize for making the right call?
No. I heard you when you said that Lizzie was Theo's patient, but I still went in to check on her because...
I know doctors like you. You stay late. You overinvest. You really, truly care about the patients. Instead of looking at them like they're needy bags of meat. And that's admirable.
Look, if you're gonna tell me that I need to find some kind of balance...
No, I don't care. You work 4 days straight and don't sleep. You're a grown-up. But it doesn't make you any better or smarter than anyone else here.
No, I never said that it did.
But you think it. Don't try to tell me you don't. Like, the truth is, if you weren't in Lizzie's room, her vitals monitor would have alerted somebody else, and they would have made the same call that you did. I don't care what kind of a doctor you are. LeBlanc, I just need you to do your job like everybody else.
She needs a few seconds for the sedation to wear off, and then we'll listen.
What happens if she can't get air?
We're here. It's time to see if she can breathe on her own. Hi, Emily. Can you breathe for us? There you go. That's it. You did it. Great job. She sounds perfect.
My baby, you are so strong. I love you so, so much.
Ali, why should you never trust atoms?
Because they make up everything. Emily wanted me to tell you that.
Thanks.
One of us should say something.
It's good to hear your voice again, sir.
Just ask.
How did we do tonight?
Hey. Is it just me or this shift started about a year ago?
Definitely it's not just you.
Do you want to celebrate it finally being over with a drink?
I have to take Amira to school.
Right. Right, it is morning after all. Sorry.
I've been trying to manufacture a 3-day weekend to make up for today, but it's impossible.
If you move Petro to Tuesday and convince Levine to pull a double.
Thank you.
Scheduling sounds like a nightmare.
Yeah, well, I heard you were up for a career bump too, so I'd get used to it.
Hey, they'd be idiots not to pick you.
I was excited for you. I'm sorry.
Seriously, guys, just... I don't want to jinx it.
Well, on that note, I'm gonna go sleep for 12 hours. I'll see you later.
Good night.
Have a good night.
I could really use a greasy breakfast. You hungry?
I'm famished.
You're too late for pizza.
Sorry. Long night.
We had fun.
اشتاق لسهراتنا. لما كنا نأرجل تحت القلعة.
بشتاق لشلون الخطايرة لعتها كانوا يحكموا علينا لما كنتي تعملي هيك.
أبوي كان يهرب وثائق النظام للجيش الحر، والنظام قصف بيتنا. قدرنا نطلع بس كان لازم نتخبى. عرفوا ايش كان عم يعمل. ما قدرنا نقول لحدا انه لساتنا عايشين. هلا هن مناح بالاردن بس
كانوا لحقوا كل حدا تركتوه وراكم.
بس 5 سنين كنتي بتقدري شوفي أي وسيلة توصلي لي فيه الرسالة.
I could have. I wanted to. For a long time I didn't know where you were. And when I finally heard that you made it, that you came here with your sister for a new life, the Bashir I knew would have risked everything to come get me, and I didn't want you to make that choice.
So you made it for me?
I understand if you can't accept that.